This doctor has identified 3 depressed patients in her practice. Each of them scored 15 on the PHQ-9 test. That's moderately severe. She could put each of them on one of 3 new programs: CBIS, or Cognitive Behavior Interpersonal Skills, Bounce Back, or Supported Self-Management. None of her patients appear to have any concurrent disorders or symptoms requiring quick action.
Hi, I'm here to see Dr. Weinerman at 1 o'clock.
Great, Jan. It'll just be a minute. You want to take a seat in the waiting room?
Okay.
Jan self-reported her depression, which descended on her when she lost her job. But she's developing a drinking problem that she hasn't yet revealed or faced herself. This could undermine her recovery. McGee mostly puts on a happy face, but her thick chart belies the facade.
This is going to look marvelous.
She has not told the doctor that she's had a couple of manic episodes in the past. If put on antidepressants, then more episodes could be triggered.
This is like so me.
Helen's anxious demeanor tipped the doctor off to her depression. She's been having problems with her boss at work. What the doctor doesn't know is that she's now being overwhelmed by memories of sexual abuse by her father.
Oh my gosh, this is so cute.
All 3 of these patients have things going on, which, if unknown by the doctor, could interfere with conventional treatment. To be safe, this doctor decides to do the detailed diagnostic screening interview to be found in the CBIS manual, known affectionately by its mnemonic, Siggy Caps Ages, Pomp Cages.
Usually you and I have a kind of relaxed conversation, but I'm going to be kind of mechanical today because I want to cover a lot of things to make sure that we've got, the right diagnosis to screen for any other mental disorder that I might be missing that might be making things worse or interfere in our treatment. Is that okay with you? So looking at sadness, if 1 is the worst sadness that you have felt and 10 is just fine, how would you rate your sadness on average these days?
1.
And most sad about what? What's the first thing comes to your mind?
Losing my job.
The first part of the interview consists of questions regarding the patient's sadness level, sleep patterns, interest or pleasure in life, guilt, energy, ability to concentrate, appetite, psychomotor issues such as slowing or agitation, and suicide. Siggy Caps. It's a good memory mnemonic. Siggy Caps.
And looking at sleep, if 1 is the worst and 10 is just fine, how would you rate your sleep on average these days?
2.
2. Does it take you minutes or hours to fall asleep?
Hours.
On average, hours. And if you add up all the hours during the night that you sleep, even if they're interrupted, how many hours on average would you say that you sleep?
Probably from about 3 or 4 to 7 or 8, maybe 3 or 4.
About 3 or 4 hours a night on average?
But then I go back to sleep and sometimes sleep till noon.
Okay, and when you wake up from your night's sleep, are you rested or not so much?
No.
Do you snore at night?
I don't think so.
No, no one's ever told you that, eh? Okay. So looking at interest and pleasure in life, how would you rate that if 1 is the worst and 10 is just fine, on average these days? Your interest.
1 is no pleasure. 1.
1. Feelings of guilt, on average these days, 1 is the worst and 10 is just fine. How would you rate your feelings of guilt?
3.
About 3. And feeling most guilty about what? What's the first thing comes to your mind?
Same, losing my job.
Losing your job. So it's really tough. So energy level, on average these days, 1 is the worst and 10 is just fine. How would you rate your energy level?
Probably 2.
About 2. And ability to focus and concentrate, on average these days, 1 is the worst and 10 is just fine. How would you rate that?
2.
2. Have you ever had any learning problems when you were a child? Never told you had an attention deficit problem? No. Looking at appetite, if 1 is the most unhealthy and 10 is healthy, how would you rate your appetite on average these days?
3.
3. Are you gaining weight or losing? You are. Okay. How much have you gained in the last week or two?
In a week or two?
Mm-hmm.
I don't know.
So how much have you gained, would you say? In what time frame?
Oh, probably 10 pounds.
Over how long?
Well, since I lost my job.
And how long is that?
8 months.
That's 8 months. That's right. Have you ever struggled, Jan, with anorexia, food restriction, or bulimia, or inducing yourself to vomit? No.
No.
Now that dragged out feeling when you can hardly pull yourself out of bed and get yourself through the day, how would you rate that if 1 is the worst and 10 is just fine? On average these days.
2.
2. And that edgy, irritable feeling, if 1 is the worst and 10 is just fine, how would you rate that?
Probably 2 too.
About 2. So now, Jan, I'm going to look at suicide. And here I want to distinguish thoughts of suicide from intent. So just looking at thoughts of suicide, if 1 is thinking about suicide all the time and 10 is not thinking about it at all, how would you rate your suicidal thoughts on average these days?
6.
6. Do you have a plan at all?
No.
No. Have you gone so far as to gather materials or collect pills or anything like that?
No.
No. So what is it that keeps you going? What gives you hope?
Well, I don't know that anything gives me hope, but I wouldn't do that to my family.
Anything else? So your family
Well,
is, yeah?
It scares me. I couldn't.
Okay. So your family is really important to you.
Yeah.
And I'm really glad of that, because what you're dealing with right now, it feels like it might be never ending, but I can tell you from my experience that you will come through this. So we'll just keep that family in mind and how important they are to you. Okay. So now I'm looking at intent. If 1 is, I'm definitely going to do this, you're not going to stop me, thank you very much. I'm definitely going to kill myself, you're not going to stop me. Thank you very much. And 10 is, I have some thoughts, but I don't have a plan, and I don't intend to actually act on it. How would you rate your intent?
10.
10. That's important. And you know that you can contact me at any time if you run into trouble, and you know that there's the need crisis line if I'm not available, and you know that if worse comes to worse and you can't get through to the need crisis line, you can't get through to me, you can go to the emergency.
I'm fine.
Okay. If I was Superman and I could magically look inside and see how much frustration and anger or rage that you deal with in there, even though on the outside it looks really calm, how much would I see in there if 1 is the most intense and 10 is not at all?
4.
4.
The next portion of the interview, known by its mnemonic ages, is about the patient's levels of anger and anxiety, including general and social anxiety.
And what's the right word? Frustration or anger or rage?
Anger.
Anger. So what are you most angry about? What's the first thing that comes to your mind without censoring?
It's the same thing. Losing my job.
Losing your job. So now I'm going to look at anxiety in general. That's that nervousness, scaredness. If 1 is the most intense and 10 is not at all, how would you rate your anxiety?
7.
7. And most nervous, scared, most anxious about what? What's the first thing comes to your mind?
Losing the house.
Okay. Now, there are several types of anxieties, and I'm going to go through them. There's about 5 different types, and we'll go through them just to make sure we're not missing anything. So one is called generalized anxiety, and this is when a person is a kind of a worrywart. They've been a worrywart usually for most of their lives. They worry about this decision, this thing they said, that thing they said. They go to bed worrying, they wake up worrying, they worry about what they've done. Can you relate to that at all or not so much?
I didn't used to be.
So that's important because what I'm looking for here is before you got depressed, when you were feeling okay, before that time. Did you struggle with being a worrywart like I described? Not so much, no. Then there's a type of anxiety, and again, I'm not looking at this period of time recently, since you lost your job and things are really depressing, but before, with the usual Jan. I'm looking at something we call social anxiety or social phobia. This is when a person is like painfully shy, excruciatingly shy, and they'll do anything to avoid a situation where they might meet new people or come in contact with new people. Can you relate to that at all? Not so much. Okay. So now I'm going to look at panic attacks. This is when all of a sudden, out of the blue, a person's heart starts racing, they're breathing quickly, they think they might pass out or even die. It comes on very quickly, and it always does leave, but it feels like it's going to go on forever. Can you relate to that at all or not so much?
It happened once.
And when was that, Jan?
When I got my pink slip.
Okay.
I thought I was having a heart attack.
And that was about 8 months ago.
That was 8 months ago.
And since then?
Not the same, not that much.
The interview continues with questions for the third part of the mnemonic, POMP, P3, OM, P2. It screens for panic attacks, phobias, post-traumatic stress disorder, obsessive-compulsive disorder, mood patterns, psychosis, and personality.
So now I'm going to look at phobias. This is when a person has a kind of over-the-top fear of open spaces or closed spaces or elevators or escalators. Nothing like that. Snakes, dogs, cats. No, nothing like that.
Don't like spiders, but
Right.
not over the top.
Okay. So now I'm going to look at something called post-traumatic stress disorder. And this is when a person has suffered a significant and serious trauma in their lives. Sometimes for a person it can be physical abuse or sexual abuse. Have you suffered either of those?
No.
And you have told me that your early life was quite fine. You enjoyed your early life. Or they could suffer other traumas like motor vehicle accidents, or sometimes it's war traumas. Have you suffered anything major like that?
No, I've had car accidents, but...
Okay. Well, when a person has a post-traumatic stress reaction to a trauma like a car accident, they suffer nightmares of the event or flashbacks, or they're hypervigilant, on edge, they startle easily, they can be anxious and irritable, and they'll do anything to avoid a situation which might trigger memories of the event. Can you relate to that at all?
No, just a little bit when I'm driving. I jump if something happens, but I don't not drive.
None of the others, no nightmares, no flashbacks, no. Any obsessions or compulsions where for over an hour a day you wash your hands or you check the windows or the stove or the doors for over an hour a day, or count things for over an hour a day, or there are thoughts that all of a sudden intrusively come into your mind and really you can't kind of get them out of your mind for over an hour a day. No, nothing like that. So now I'm going to look at mood patterns. The first thing I'm going to look at is something called dysthymia. It just means difficult mood. And this is when a person has a kind of chronic, low-grade level of unhappiness that's always there under the surface and that kind of lurks and never really goes away. And it can go back from as far as they can remember. It often signifies a difficult early life, which has not been your case.
No,
That
before
doesn't-
this I was fine.
Okay. And then if a mood deepens, deeper than that kind of mild, minimal unhappiness, deepens to a deeper depression that affects some of the things we've been talking about. And if that lasts for 2 weeks solid or more, we can call that a major clinical depression. And then treat it or not, it often gets better, And then if it happens again, we can call that a recurrent major depression. Have you had previous episodes prior to this one of a major clinical depression?
One other time.
When was that?
It wasn't as bad as this.
Mm-hmm.
It was about, well, it was after my son was born, so it was 15 years ago.
Right. And what got you out of that one?
I went on medication.
Mm-hmm.
And time.
Mm-hmm. Do you remember what medication it was?
I can't remember. I think it started with a P.
I'll look it up in my chart later and we'll make sure, because it helped you at that time.
Yeah.
Okay. And is that the only time you had a previous episode of depression prior to this one?
Like this.
Yes.
I mean, there's been other times when I haven't felt good or felt down or something, or things weren't going okay, but...
And did they last 2 weeks solid without a
No.
break? No. Okay. Now I'm going to look at the opposite. This is where we're looking at bipolar disorder or manic depressive disorder. And this is the opposite kind of mood. This is when a person can be up for nights on end without the need for sleep, feeling super energized, on top of the world. Some people feel quite euphoric and elated, and some people get quite irritable. They're talking fast and they're thinking fast. They're spending money like it's going out of style and getting into debt. They can be sexually aroused and being quite promiscuous. No. Their friends
No.
are telling them they better slow down, they're going too fast.
I like some of that.
It's good to see you still have a sense of humor. But that has not been something you've experienced. No. Okay. All right. Have you ever lost touch with reality, where you hear voices or you see things that aren't really there, or where you feel that anyone can magically control your mind or magically put thoughts into your mind? No, not so much. That certainly hasn't been my experience with you. And in general, now I know you pretty well, Jan, but just for completion's sake, how would you describe your personality? Are you someone who's kind of a suspicious type, or an eccentric, kind of odd type? Or you're not, also I don't think you're very kind of emotional, sort of chaotic type, or feel that you're kind of more special than other people, or very dramatic. I know you as a pretty stable kind of human being that has a lot of good relationships. Yeah.
Usually.
Yeah, usually. Would you call yourself perfectionistic, or someone who
No.
avoids things, or...
Well, now.
Yeah. So I agree. I can't see any one of those particular characteristics speak about you too much. So now, Jan, just to be thorough, I want to just review the idea of substances like alcohol or other substances. Just to want to make sure that we're covering everything.
CAGES, the final mnemonic in the questionnaire, focuses on substance abuse. It probes whether a patient has ever tried to cut down on drinking, been annoyed or felt guilty about others commenting on the drinking, or used alcohol as an eye-opener after a heavy drinking bout. These are all good indicators of alcohol abuse. Finally, are there other substances in the picture?
How much do you drink a day on average?
A day?
Yeah. Or a week or a month?
Maybe 3 or 4 beer a day.
Ah, okay. Right. Are you concerned that this is a problem at all?
It's a problem with money.
Uh-huh. So if you had enough money, I mean, I know you lost your job, you would be drinking those 3 or 4 beer. What's the payoff that you get from drinking those beer?
Well, I wasn't doing that when I was working.
Okay. And now, what is it that you get from it?
Gets me through the day. Something to do.
Are you annoyed at all
Relax.
that I'm asking you these questions about it?
I don't care.
No. Any sense of guilt about drinking 3 or 4 beer a day?
Only that I'm spending money and I don't have the money.
Okay. And how early in the day might you start drinking? Would you wake up and drink a beer? No. When does the drinking usually happen?
Well, afternoon, evening.
Okay. Is there any part of you that is concerned about it, or not so much?
Doesn't seem like that much.
Okay. I think 3 or 4 beers is getting close to being a bit concerned, but we'll just keep that in mind. Any other substances like marijuana or cocaine or anything like that? No. And so thank you for that. We've covered a lot. You're really terrific.
So what does that mnemonic add up to? Siggy caps, ages, pomp cages. One more time. Siggy caps, ages, pomp cages.
I just have a couple more questions. So looking at family history, has anyone in your family suffered from depression or anxiety or bipolar or schizophrenia? Remind me, Jen.
My mom had depression.
The doctor is finishing off the diagnostic screening interview with questions about the patient's family history and medication history.
Just your mom. Okay. And medications we've kind of covered, kind of in summary. I think the good news is that you're struggling with a depression, and a depression is really treatable. People with depression, they can get through it, and so we're going to help you with that. So you have a recurrent depression. This is your second episode. The first one was with the birth of your son, and this one was triggered from the job loss. So very much situationally related. And other than that, really we haven't picked up anything very much at all. You had a panic attack 8 months ago, but nothing more after that. And you weren't drinking before the job loss, and you're drinking in order to help you get through things. So I think that we can find other ways to help you get through things. I'm going to give you a problem list. And here it is. Take a look at it. It's a sheet of paper that really says for you to list every problem that you've got, from anything to do with finances to anything to do with emotions. Now, I know you quite well, but sometimes we miss some of the problems that are going on. I want to know everything, because if we don't know it, it'll be a problem.
Okay,
Do you think you can do that?
I can do that.
What's the chances of you doing it out of 100%?
I'd like to say 100%, because I have to come back, and so I will do it.
You will do it. Okay, we did some
Ensure
good
that
work.
your patient is committed to the process, a rating of 75% or above. Otherwise, you may not make progress. Finally, confirm your diagnosis with the DSM-4.
In this manual that we call CBIS, you'll find the diagnostic screening interview. It is practical, easy to do, and should take you 20 minutes. In the next section, I'm going to show you how to make use of the problem list. Thank you for watching.